I'm an orthopedic surgeon, and I take care of problems that affect the musculoskeletal system, so that's bones and joints. I take care of children, elderly patients, and typically complaining of pain in a shoulder or a knee or a hand. Orthopedic surgery is a very fulfilling specialty, and it's something that I enjoy a lot. I like to solve problems, and orthopedic surgery is about solving problems. There are a lot of people that you can choose to access healthcare through. A lot of excellent surgeons, very talented individuals. And I think that what sets my practice apart is actually the focus on relationship. Relationship is what helps you have a successful doctor-patient encounter. A bit of me goes into that person, every patient I treat. And so I wake up at night frequently wondering, how's this patient doing? Or when I see a patient doing well, that is a high five, and I mean, I'm so happy for you. I wish nothing but the best, and that just makes me feel really, really good. I went to school at Loma Linda University. Loma Linda has long held up a principle of balance in a person's life, and so there's a spiritual component, there's a physical component, and there's a mental component to a person's health. And it's not uncommon to have a person with pain, but the pain is because you can't achieve something that you need to at your home or for your family, and so understanding what other factors are contributing to the symptoms or the diagnosis is critically important. For me, it's really important that people understand when they make an appointment in my clinic or they choose to access care, kind of the philosophy of care that I carry. And that comes down really to the root meaning of the word doctor. That comes from a Latin origin, and it means to teach. And so my goal for my patients is that we can understand what is going on with their body, how the problem affects their lives, and then we can develop a treatment plan that's unique for them and allows them to get better.